Well, my name is Amal Nirgutkar. I'm the CEO of Patient Prism, and I'm delighted to welcome JoAn Majors into our studios this morning. JoAn is absolutely wonderful. She is a certified professional speaker, author of 4 books on everything that has to do with improving the practice of dentistry and empowering teams and making them perform at their very peak. And she's done that over and over again for over 20 years, over 2 decades. And she's founded the Soft Skills Institute. And I've been waiting for her to come here in our studios to talk really about many things we do, and she's supported our cause in many, many ways. The first segment is really about how do you create an optimal system for call conversions right at the front, because it goes at the heart of what Patient Prism does.
Well, thank you for having me, Amal. I think it's really interesting because one of the things that we think about is, we've talked about it before, I'm a dental assistant, was a dental assistant for years, and there are a lot of different certifications you can get as a dental assistant or clinical people. There are many, many certifications, but you think about people that we put on the phones, and very rarely do we set them up for success the way we do people who work in the clinical aspect of it. And we think if somebody has a great personality and they were the best teller and everybody lined up on the 15th at their line at the bank, that they have the skills to do this, which it is about attitude for me. It is a lot about attitude. But the truth is we don't really set them up for success. And so one of the things we do with Soft Skills Institute is we specialize in creating these soft skills specialists on the team, because I think that what happens is we don't understand how it works to have somebody have this system on the phone. Not to say we want a bunch of robots. That's not it at all.
Of course.
But a doctor would never dream of putting the filling material in without etching the tooth and preparing it. So why would we think that we should put someone on our phones that we haven't set up the same way? And it began years ago when I started working with Dr. Mish at the Mish Institute. My team and I would secret shop all of the doctors who had come to take this expensive implant training. And what we found was that they were spending, $60,000, $80,000, $100,000 by the time you considered time out of the practice to learn this skill. And the people on the phone knew nothing about how to set it up, preheat, if we will, how to prepare those patients. And so the shopper for that is no different than the shopper for Invisalign or sleep apnea or anything else. And in our studying people, when we call these offices for secret shopping, what we found is when they had no system and they were left on their own, in dentistry we have this thing to be big brain. So when someone asked about implants or wanted to know what an implant was, we wanted to use big words, because many times that made us feel like we knew, well, it's a metal rod that goes into the bone, or it's titanium, and all of those things. And what we found was that they missed the simple part of connecting with the patient. Because that's how they become the patient. Is that initial connection. Yes, they think they want to know about implants, and the only thing they know generally to ask about anything is, how much does it cost, or do you take my plan? So it's really, it really speaks to the heart of what you do to help the practices when you understand that they've still got to have that system to set them up for success. And ours was to make that initial, we call it a telephone handshake, to make that initial connection be something besides yes or no, and answering a question like, what's an implant? So
it revolved around making them confident about what they were talking about. And kind of not really using big words. Just connecting with the patient, because the patient doesn't know the words.
They don't.
Right? Patient know what they know. And they know that they're in pain, they cannot chew, and they're scared about cost. So it really is, your system was developing the soft skills that earn the trust of the patient to take the next step, which was come into the office, and then the process continued.
Well, I think it was about, I'd always say, you don't have to feel like you're selling anything. What you're selling is this doctor and his or her skills, because that I can market, right? If I'm here and I believe in my doctor, then that ought to be pretty easy for me. So that's really what it's about. But we got caught in that, thinking we needed to know technical, and we were really wrong. When I wrote my first book, in 2006, when I was working with the Mish Institute, I remember distinctly having a conversation with Dr. Mish, and he said, when you do this, you really, that thing you do about the man-made roots, you need to have that be one of the initial chapters, and one of the initial, we call them action items, we don't call them chapters, because I think it's about taking action. It's not about reading anything if you're not going to apply it.
That's right.
But it talks about everyone really being comfortable, and in our office everybody's really comfortable saying it's a man-made root with man-made teeth on top of it. And what I always go back to is I think about, you know, my husband, I'll even hear my husband sometimes say, well, technically it's a man-made root and, you know, we'll design some sort of man-made teeth to go on top of it. Yes, we have engineers. We're in the land of Texas A&M University,
right,
where they've got one of the largest engineering schools around.
Sure.
We have people that say, what exactly is that?
Right.
But the biggest portion of our patient base don't really ask that question. What
Correct.
they want to know is, oh, well, that sounds easy. And I think about when we would do this secret shopper, you know, we would call many offices. We'd get a lot of different confusing answers. And then when somebody got a confusing answer, they'd say, you know, that's not, somebody else is going to have to talk to you about what that is.
Right.
Hang on. And so they'd go get somebody else, and everybody said something different. So what happened is the patient got these mixed signals, and they're like, okay, they don't know what they're doing. I'll go somewhere else.
Absolutely, because the patient is looking to really believe in you and place their trust in you.
That's right.
And so if the system itself doesn't lend to creating trust, and you lose patients' trust as soon as you use big words, because they don't understand it, they shut down, right?
Yes.
So that's what it's involved. I'm excited to hear more about this. Thank you for this wonderful discussion.
You're welcome.
Thank you.
Thank you.